I think we got a special guest tonight, man. This brother is a dynamic brother, graduated of South Carolina State University, Morehouse graduate, in the medical field. I call him Mr. Cheeks. He hangs out Pretty Lou, Freaky Ty, Lost Boy member. Nah, I'm fuck with y'all. Jamie, bringing out good brother from another mother, Dr. Cheeks.
Dr. Cheeks.
What up,
Hello, everyone. How's everyone doing tonight?
We're doing good, brother. How you doing? Thanks for coming on.
Good. I see him going in on my name now. Of course, I heard it all.
Yeah.
I mean, I played football, so I heard it all from butt cheeks to ass cheeks to white cheeks. I heard
it all. Curtis Blow, all that kind of shit, right?
All that Curtis Blow. Yeah.
Long as they don't call you sweet cheeks.
So here's a funny story. I did my training at Grady Hospital, and one of my fellow classmates was down the hall, and she called me, said, Cheeks, come here. And all these girls came running out of this room because they thought I was the stripper in Atlanta for the last name.
That's classic, man. That's fine. That's good shit.
Yeah,
that is good shit.
Yeah.
So, doctor, tell people a little bit about yourself, man, because I want to go through the whole history. Just a quick.
Sure, no problem.
30 seconds.
I'm a graduate from South Carolina State University, the Mighty Bulldogs, and then I came on to Atlanta. Went to Morehouse School of Medicine to finish my. Just started and finished my medical degree. I'm a family practice physician. I have my own practice. I've been open. My practice has been open for 10 years now. We celebrated our 10-year anniversary this past January.
Congratulations.
So yeah, big ups to that. And so I see everybody from ages 2 years old and on up, do a little bit of everything. And that's kind of why I went into family practice, because I don't like seeing just women or just elderly. I like to see everybody. So I get to see kids. I get to see women. I get to do pap smears. I get to do sports medicine. I get to see the elderly. I do internal medicine. I do dermatology. I get to do minor surgery. So as a family practitioner, I get to do a little bit of everything. So it keeps me on my toes. And so that's why I like being in family practice right now.
That's what's up, brother. Since we're in the top, we're in Women's Month, right? Women celebrating Women's Month here. One thing that I noticed in the Black community is like fibroid tumors is big in the Black and the community. And some of the things people saying what causes fibroid tumors. I heard it from saying deodorants, from the dyes, from the perms and all that stuff, and the hair dye. I mean, some of these women do need to keep some of that deodorant. Some of them need that aluminum. They underarms. Look, they need that They need that aluminum. They need the underarms. Come on, no strobe.
They need the hair did. I get it.
Yeah.
But unfortunately, none of that is a cause for tumors, for fibroids. So fibroids are benign tumors that grow in the uterus. The only causal link they've been able to find is vitamin D deficiency. Now, African American women are unfortunately are heavily purported to get fibroids, much more than their white counterparts or their Asian counterparts. But there's no causal link to deodorants and dyes and braids and hair products or anything like that. And most women, 70 to 80% of women, will get a fibroid by the time they're 60 years old. Now, whether or not that fibroid is going to cause them any problems, that's the big question. But most will get a fibroid if they live to be that old. And so the best thing to do is make sure they stay on top of their health exams. Go get your pap smear. Ladies, please go get your pelvic exams. If you've been with the same partner, then you can go every 3 years. But if you're changing the partners, then you need to go every year. And the pap smear is a screening test for cervical cancer. That's right, cervical cancer. Now, your physician, when they do their manual exam, when they're putting their fingers inside and palpating, that's when they're looking for things like fibroids. If you have any heavy bleeding, menstrual cycle where is lasting longer than 7 days, or you're changing your pad every 2, 3, 4 hours, then that's when you need to go and talk to your doctor and be evaluated to see if you have fibroids. And the way we do that is usually via an ultrasound. You can get an ultrasound done just like you do when women are pregnant, when they have a baby inside. We use that same type of ultrasound. or an MRI to determine if you have any fibroids. And then at that point is when we determine the size of them. Women can have one fibroid, or they can have as many as 30, 40, 50 fibroids, and all of them can be different sizes. So it's important that you stay on top of your health and go see your doctor and stay on top of your preventive health screenings.
Doctor, let me ask you this question. I noticed today, and I'm sure we all see it, cosmetic surgery, people changing their bodies, people enhancing their bodies. It seems to be the new trend. It seems to be very, very commonplace. And I want to know, are there any like long lasting effects in the negative from that? Or is it just something that's just the way of the world today, and it's the normal in the medical field?
Good question. So I was just having a discussion with someone the other day about the liposuction. Every woman wants to go get liposuction, and now they're all trending down to Miami to get the Brazilian butt lift. I have patients who are going out of the country to Costa Rica, Mexico, Dominican Republic to get these procedures done. And when I was talking to them, people need to realize that when you get liposuction done, they are sucking out fat cells. Okay, so you no longer have fat cells in that area, but you have fat cells everywhere else. And so when you start gaining fat has to go somewhere. So it may not be in your midsection, maybe in your thighs now, maybe in the area below your knees, maybe in your arms, maybe in your back. So that fat has to go somewhere. And so when you are getting this procedure done, realize that you are taking a risk that in the future, your body may not be proportionate, because now you have a small waist, but now you got big arms and big thighs and big legs, because now your fat is gone there. So that is a big concern. And of course, if you're going out of the country, please be very careful. Please research who you're going to see. I don't necessarily advocate for you going out of the country, but if you feel like that's your best route because it's less expensive, then please research who you're going to see and have a backup plan as to what you can do once you get back to the States if there's a problem. Because there are a lot of problems. There are problems. In fact, what's the young lady on TV now? She has a show all about the cosmetic procedures that have gone wrong. So, yeah, please be mindful of that.
Mm-hmm. Jamie, can you bring back Shauna's statement real quick? Bring it back up, please.
Yeah, she said most GYNs don't do yearly PAPs anymore.
It's not the GYN, it's the insurance company. So this is the way, it's the insurance company not wanting to pay for it on a regular basis. So it's not the GYN. So the way to get around it is to just ask your doctor, tell them that, hey, I want mine done on a yearly basis. What happens is when the doctor tells the patient, you don't have to get it on a yearly basis, the patient just accept that because they don't want to get it done anyway, because it's uncomfortable. But no, if you want to get yours done, then you want to stay on top of your health, and all you do is say, I want to get it done, and your doctor will probably do it for you or get it done. And even if they have to code it differently as, a discharge, a vaginal discharge. Every woman has a vaginal discharge at some point. So that is a diagnosis that all of them can have. So yeah, just ask your doctor and stay on top of them. Remember, you are the driver. You are the captain of the ship. Your doctor is there to make suggestions and recommendations, but ultimately, you're the one that's in control. You make the decision. It's your health. So I urge all of our patients, take control of your own health, take control of what you want to do, and ask. A lot of times, patients don't feel like they don't get all of their questions answered. That the doctor has an agenda and the patient has an agenda. And truthfully, that happens a lot. A lot of times patients come into me and I have an agenda of things that I want to go over, and the patient has an agenda of things that they want to go over. And a lot of times we don't have enough time to do both of those. So what I suggest to patients, make a separate appointment. You can have an appointment the next day. Can't be the same day, but next day. Tell the doctor, on Monday, that was your appointment. On Tuesday, this is my appointment. These are the things that I want to go over. And you have a list of 3 or 4 things. Don't have a whole bucket list of 20 things that you want to go over, because that doctor just doesn't have time to do that anymore. But 2, 3, 4 things, then yeah, make your appointment just for you. He has his day, you have your day.
I see. I think it was K Michelle. A few of them now, like Instagram, they're getting rid of all that stuff. I'm like, I wish somebody would suck some of this fat out of me. I'll share it with the ladies that want to get ass and tits. I got enough for everybody. Now,
I'm sorry,
Yes,
D.
sir.
Go ahead.
no, I was asking a question because my mother's just getting past breast cancer. Any reason? In your research, anything is deodorant, anything like that, causing from the breast cancer or causing breast cancer?
No, nothing like that.
Breast
But
cancer?
make sure that women get their mammograms done. We start getting them done around age 40. You're supposed to get a one around 35. We call that a baseline mammogram, somewhere around 35. And then at age 40, you need to start getting them on a yearly basis. They're very inexpensive. A lot of the companies, a lot of the organizations are doing them for free. So make sure you stay on top of women. Stay on top of your mammogram. Men, stay on top of your loved ones, your female friends, your female family members. Make sure they stay on top of getting their mammograms done. Try to go to the same place if you can every time, because that way they have the records and they can compare them to your previous year's mammogram.
Wow. Yeah. Shauna checking in. We got a few comments.
Yeah, bring them,
Bring
Shonda, then go back to bring them to Shonda, then bring them to Keisha's.
Yeah, she says, real talk, my female black GYN was horrible. She never listened to anything I said.
And that's
she misdiagnosed my sister-in-law's breast cancer. Wow.
Yeah. So when it's like that, a lot of times physicians, unfortunately, we're on a time crunch now. It's all about how many people you can see in a 7-8 hour day. Unfortunately, insurance companies have caused that to happen. So it's your health. So take control. And like I said, make another appointment just for you. Now you got to you're gonna have to pay for whatever your copay is, but make it your visit. And the doctor can't say anything about it because you're on their schedule. You're paying your copay. You can't do it on the same day, but you can definitely do it the next day.
Bring them to Keisha's, Jimmy.
She asks, can blood tests detect all diseases?
No. Blood tests can't detect everything. So, in fact, blood tests can't detect cancer. Cancer is detected using a biopsy. So, let's take prostate, for example. In fact, I just got off the phone with a gentleman who has prostate cancer. His PSA, which stands for prostate-specific antigen, his screening test for prostate cancer was elevated. So at that point, he has to go see a urologist, and the urologist does a biopsy to determine. Then that is being sent off to a lab where they look at it under a microscope to determine if it's cancerous or not. So the blood test wasn't able to tell them it was cancerous. Only the looking at it under the microscope, the biopsy was able to tell that it was cancerous. So the blood test was a screening test to determine you have a likelihood that this may be cancerous. Let's see what it is.
So Doc, question, because we got 4 men on here.
Sure.
Now, after you do the blood test, right, and say the blood test come out, maybe kind of cautious. Let's go see. Do they got to put the fingers up your ass, or how does it go?
Okay, so we most physicians have stopped doing that.
Woo! Not mine. That's his thing. That's his wheelhouse.
I know, and most physicians have stopped doing that because the efficacy of finding something using your finger is not great. You're not going to find, not unless it's a very large size, or you're going to find cancer. So it's much easier. So it's much easier to just do the blood test and determine it from that way. And because men were afraid of the finger, that was preventing men from coming into the doctor.
Yes.
And so we're trying to get away from that now to say, hey, the PSA is just a blood test. The PSA is just a test that we're going to draw your blood and we're going to look at it and determine if you are likelihood of having prostate cancer. We start doing that at age 40. Now, age 50, we start doing the colonoscopy. That's a screening test for colon cancer. Now, that's the cancer that took out our beloved Black Panther. So be mindful of that. He was less than 50. So they're actually trying to decrease that age. Now, there is another test called the Cologuard that is recommended for those age 45 and above. And what that is, that's a simpler test that you do at home, and this detects colon cancer. You do it at home. They send you a kit. You basically put stool in this kit, and you send it back to the company, and they send you a report a few days later and tell you, yes, you have a likelihood of cancer. No, it's not a likelihood of cancer. And that is sufficient. It's 92% effective.
Yeah, that's the one I did. I did that one too.
Yeah. Mm-hmm. Now, the bad thing about it is, as opposed to the colonoscopy, if it comes back positive, now you got to go get a colonoscopy done. Versus if you were having it done already, they saw the cancerous lesion, they could have snipped it and taken it out right then and there.
Okay. Doc, I got a question for you. Can you give us any tips on how to avoid or manage your high blood pressure or diabetes?
Sure. All those are what I typically call, unfortunately, Black people diseases, because we are disproportionate getting those diseases: high blood pressure, high cholesterol, and diabetes. A lot has to do with our diet, unfortunately. We grew up eating the pork and the bologna and those hot dogs. All y'all remember those fried bologna sandwiches from growing up?
That's true. Yes.
Some of us are still eating it.
Some are still eating it. Yeah. So we got to break away from that. And so a lot of it is diet. So we need to improve our diet. We definitely need to exercise more. We don't exercise as much as we should. And no, working and running behind 2-year-olds and 3-year-olds is not considered exercise. We need to exercise more on a regular basis, and we need to eat more fruits and vegetables. That will cut down on most of our diseases that we're heavily getting, unfortunately.
Is salt a contributor to high blood pressure too?
Salt does, because we do put a lot of salt in our foods. So what the thoughts are is that those slaves that made it from Africa back to the United States, those had a lot of salt in their bodies, so therefore they didn't dehydrate along the way. And as a result, those are our ancestors. And as a result, now we are getting high blood pressure as a result of that. High blood pressure has a genetic component. High cholesterol has a genetic component, so does diabetes. And unfortunately, you can't get away from genetics. If your family has it, then there's a good chance that you can get it. So what you do is you got to start exercising, you got to start watching what you eat, and taking control of your health. I keep telling people, we all have things that we want to accomplish, and it's hard to accomplish those if your health is not good. So stay on top of your health, and keep doing what you need to do in order to stay alive.
Yeah, I think some things. Do you think like when you just bringing it up? I was telling people like the only people that survived the Middle Passage was Black people because of the soil. We hold water. Do you think taking us out of our natural environment and bringing this into the Americas has changed us a lot?
The Western diet, sure, by all means. Back in Africa, we was eating what was there, which was a lot of fruits, a lot of vegetables. But we came here, and so now we're having to eat different foods. And so, as a result, our Western diet is much worse as opposed to the Asian counterparts who eat a lot of rice and beans. So unfortunately, that's where we are right now. I don't think we can go back and survive over in Africa like that. But right now, eating this Western diet, yes, we are at risk.
Wow. So
somebody asked about uterine cancer. Can you
bring them on, Jamie.
Yes, uterine cancer scares me because I've been told there's no symptoms. I guess she means, is that right? Yeah,
that's true. Uterine cancer, cervical cancer, and ovarian cancer. Ovarian cancer was the cancer that claimed the life of Martin Luther King's wife. And unfortunately, there is no symptoms other than you start feeling some pain and some fullness in your flanks. Now, there is a school of thought that once women get to a certain age, past that childbearing age, then go have your ovaries taken out, because now they're not good anymore. They're only a setup for cancer. Some doctors are even thinking maybe women should actually have their breasts taken off after a certain age because they're only a setup for cancer now. So the way to keep abreast of all of this, your ovarian, your uterine, and your cervical, is go to your GYN, go to your primary care doctor, and get your pelvic exam done, get your pap smear done. Part of your pap smear is also checking to see if there's any cancerous cells in your uterine lining as well. So keep going to your doctor.
I want to ask. I'm sorry, Derek. Go ahead.
No, I just want to circle back really quick to something we back to the fibroids. Okay. I remember hearing a long time ago from a woman. She said that there might be some sort of correlation between a woman giving birth and having babies and having fibroids. Like if she had birth, or if she gave birth, or she was pregnant or something, she was less likely to have fibroids. And she told me something like it was almost like that was the body telling you that it was time for you to have a baby or something like that. Is there anything like that? Have you ever heard?
Well, what I think is more of the reverse. If your fibroid is too large, then it's unlikely that you'll be able to get pregnant and have that carry that baby to term, because now the baby and the fibroid are growing pretty much almost at the same rate, and can cause there's only so much space in the woman's body, and so that fibroid can affect the nutrition of the baby and cause women to have a miscarriage. So that it may have been a reverse that person was saying. So if you have fibroid, it does make it less likely. If it's a fibroid that's causing problems, I need to say that it's a fibroid that's causing problems. It can cause you not to be able to get pregnant or carry the baby to term.
Doctor, let me ask you this. I noticed today we have a lot of emphasis placed on mental health. I don't know that our community puts the same emphasis on physical health. We've had situations where you'd have a pop star that may be overweight, and if people, you know, in the fitness world have commented on it, they feel that it's body shaming. I believe our country leads the world in obesity. I believe our community is very high in obesity rates. What is the correct approach to trying to explain to people, especially younger people who are kind of into the fast food and don't really think about their mortality? Is there a certain way to try to get the message across without having to deal with the backlash of people feeling that you're shaming somebody? I mean, how urgent is it to get the weight down or off?
Good question. Here's the thing. All those people that are, let's say, of the large size variety, they don't want to be large. They know they're large and they don't want to be large. They just, you know, don't want people to make them feel bad about them being large. So you need to be sensitive when you talk to them. It doesn't need to be in a crowd. It doesn't need to be, you know, via social media so that everybody can say it. But if you are genuine in what you feel, that you are concerned about their health, concerned about their future, concerned about, you know, their longevity of being able to take care of the things they want to do, then you should be able to have that conversation with them and be open and honest with them and offer them suggestions, you know, whether it's, you know, exercising, whether it's, I tell people sodas, just simply cutting out sodas out of your diet. Sodas are, I call them the devil. Sodas are so bad for you. So if you can cut sodas out of your diet, that'd be great. When you go to Chick-fil-A, don't get the soda, just get a bottle of water. Drink water. Drink as much water as you can. When you go to the grocery store, park in the back of the parking lot so it gives you a reason to walk further into the store. You know, some way you got to be able to get some exercise in your life. And it's very hard that I'm realizing with all of us being so busy, it's hard to exercise in the evening because life gets in the way. Family, kids, you're tired, you don't want to feel like it. So the best time to exercise is first thing in the morning. So in order for that to happen, that means you need to go to bed early. So if you can go to bed earlier, an hour earlier, then you can get up an hour earlier and exercise. And you don't have to buy a gym membership. There are things you can do in your own home. You can walk up and down your own stairs. You can jump rope. You can do something called burpees. You can, you know, do push-ups. I have one of the things that I've told my patients, especially my male patients, most people take at least 2 showers a day. So every time you're in the bathroom and you're waiting for the water to get warm, get on the floor and start doing push-ups. Do 25, 30, 40, 50 push-ups until the water gets warm, and then you take your shower. At least you're getting some exercise. So find things that you can do in your house without having to spend money on a gym membership or equipment or anything like that. You know, it's beautiful outside, so start walking. Just do something. But yeah, you need to get up in the morning and do some form of exercising.
Yeah.
Sorry, Rodney.
Yeah, thanks, D. D had said something about this earlier as far as you know, women with breast cancer. But how common is breast cancer amongst men, and what are the signs when it if you were to encounter it?
Good point. Breast cancer in men happens about 10%.
Okay.
10% of the breast cancers are in men. And what men are finding is pain. Pain is usually the first symptom, or an uneven breast size. They may notice a lump on one side that's not on the other. And so those are the common symptoms. And if you feel that way, then by all means go to your doctor and they'll do the same test. If it's not a mammogram, they're going to do a CT scan or MRI or some type of ultrasound to determine if it's cancerous or not.
Okay.
Okay.
And
Yeah,
if it's
be on top of that also.
And if it's detected early, it most likely you'd probably be able to get something you'd be able to get through, right?
Yes. Every cancer we have known that if it's detected early, you have a much better chance of survival. And that is why we urge people to stay on top of their health. That's why we urge people to start, getting their mammograms at age 40, colonoscopy at age 50, your PSA with your prostate, get that checked at age 40. So all those things need to get checked as early as possible.
So Doc, I'm kind of upset with the soda thing because you just messed up for a whole bunch of black people, like Jack and Coke, Hennessy seasons coming up, all that stuff. You don't mess it up for everybody, man.
Right.
So how bad is alcohol in our community? Like you said, sodas. How about the alcohol? I got a few questions.
Alcohol in moderation is okay, but if you drinking, a 6-pack every night, or you drinking 2 cases on the weekend, then that's just too much. But drinking alcohol, 1 or 2 drinks is okay. And in fact, alcohol has been proven to actually lower cholesterol if taken in moderation. But the key is in moderation.
Doc,
yes.
Can you expand on that a little bit? When you say moderation and you say 2 drinks, how often? Like once a week, once a month?
And what we talking about? You saying what black people, is it dark liquor, light liquor?
Yeah.
Because we got our thing. Everybody got their thing. They got that.
Everybody got that thing. I appreciate it. I understand. So alcohol is alcohol when it comes to what you're drinking. Now, wine, fortunately, wine will give you will help lower cholesterol. Red wine has been shown to help people lower their cholesterol. Now, as far as the dark liquor, the brown liquor, the light liquor, that has its detrimental effects on your liver. So we need to be mindful of how much we're drinking. 1 drink, 2 drinks at the most every several days is okay. But if you're drinking 3 or 4 drinks a night, then we have a problem. Okay. And those problems can be detected through blood work. And so when you go into your doctor to get your annual physical, he'll do a blood test that would look at your liver enzymes, and that's where your alcohol will show up. Your alcohol will affect your liver enzymes.
Doc, how are we doing with weed? Weed seems to be. I know about 2 people that don't smoke weed, and I'm one of them. So what is it? What is it with weed and alcohol?
What are you trying to say here, Kelvin?
I was going to wait till the doctor left.
Who are you exposing?
That was a joke. That was just a joke. That's for TV sake. But no, I noticed that is one of the big things, and I'm hearing a lot of information about weed. Some people, I hear this all the time. It's from the earth, so it must be good. I always think poison ivy is from the earth as well. I mean, as a result,
I say cocaine is from a plant. So
right.
That's not
right. Exactly. So I just noticed there's so many people that feel that it's a wonder drug, and maybe in some cases it is. I'm sure there's different grades of it. What's your position on weed and what people need to be aware of when we come to the subject?
Good question. I don't think we know fully what marijuana can do. I think we're still testing. I think we're still trying to figure out exactly the medicinal properties of marijuana and what it's able to do. It's been shown that it's helping people with pain, helping people to sleep, helping people with anxiety, and I think that is going to be one of the biggest changes in this generation. This younger generation that are in their 20s now and the young 30s, they smoke marijuana like they're taking Tylenol. They're smoking every day, 2 or 3 times a day.
How is it with pulmonary function? That's why I always wonder, is it good to put smoke in your lungs in any capacity? That's what I always wondered about.
Sure. And one of the things, as opposed to those who are a little bit more seasoned in their 50s and 60s, marijuana was more of just a recreational thing that when you got together with your friends, you did, and that was it. But now it's more commonplace. It's more acceptable. I saw an ad on the TV the other day about them, and they were advertising to seniors to take CBD oil for pain, to take CBD vaping for pain. So I don't think we know enough about marijuana or CBD oil or THC to make a determination. I think that's going to be down the pipe. I think a lot of people there's research going on right now. But I don't think that it is a bad thing. Just so long as, like I said, we do it in moderation. Just so long as we are, it's not affecting your workday. It's not affecting your family life. I don't want you out smoking marijuana and the kids are in there not being able to be bathed and they're hungry and everything else. You outside smoking. We don't want that either. So I think right now we need to take a hard look at marijuana and its medicinal properties. And we'll see over the next few years. It's going to be very interesting because more and more states are legalizing marijuana, and everybody's looking at the money that's involved in it. And it's a huge amount of money. And so we'll see what's going to happen over the next few years.
Doc, I got a question. So
sure.
You say it's about to get warmer and stuff like that. Like black folks will be like, I don't get worried about getting no skin cancer and all that stuff like that. How big is it in our community, and what can people do to protect themselves against that? And I got a few more questions after that.
Sure. Yeah, black people still get skin cancer. So don't think just because you're black you're gonna get skin cancer. Mm-hmm. So you need to use some type of sunscreen, even if you're not at the beach. So on your regular day, your daily routine, your daily moisturizer, you need to add something, at least an SPF 15 sunscreen into your daily moisturizer, your daily skincare, to help prevent you from getting skin cancer. And you need to put it in places that are sun exposed. The top of your ears, back of your neck, your nose, your forehead. Those of us who are bald need to put it on your scalp. So those are the places that the skin, that the sun rays will help. The sun rays will cause you to get skin cancer. So you need to make sure you put something on those areas.
Okay. Another question, like arthritis, like, as we get older, all of us men or gentlemen, getting in our 50s or older. So like, how do we can prevent arthritis, and what anything that, if there's any kind of cures, what are your thoughts?
So osteoarthritis is basically inflammation of your joints. It's kind of the wear and tear. It's like your brakes on your car. When your brakes, when they wear down, they're going to wear down just like your joints will. So those of us who play sports, those of us who've been who've been in car accidents, heavy manufacturing jobs, labor jobs where you're using your joints, using your muscle, they're going to wear down over time. And that's the osteoarthritis that they talk about, that old people talk about. Now, what you can do: exercise, lose weight, take anti-inflammatory medicines. And I'm not talking about, Tylenol. I'm talking about ibuprofen, naproxen. Those things will help decrease the inflammation that's going on in your joints, in your body. Your body tells you when it's sore. Don't try to push through it. It'll tell you that even if you're someone who exercises on a regular basis, if your body's tired, then take the day off. Your body's tired. It's telling you something. So listen to your body. But the main thing is lose the weight off your joints, because as you walk around with all the weight, that puts joint on your hips and your knees. So losing weight is one of the biggest things that you can do. And staying active. Definitely staying active.
I'm asking
now, does water work as a lubricant? I heard that water helps with the as far as the cartilage or whatever like that. Is that important with as far as
drinking water? Well, drinking water is always good, but if you're talking about being in a pool and
no, I mean drinking in particular.
Yes. Drinking water is definitely good. Drinking, we need to drink more water. We replace water with, now we're drinking sodas and Armor, whatever, all the different drinks, the fruit drinks, that we're drinking. So we need to drink more water, definitely. Stay away from the sodas.
This question's for a friend. What's your thoughts on edibles? Just asking for a friend.
I got you. I feel you. So
a close friend.
Edibles are you're taking in marijuana in whatever you're eating. Now, your stomach acids will kill most of what you're eating. And that's just the way your body is. And so I've looked at some studies, and when you're taking in something into your stomach, you're only getting about 2 to 5% of the marijuana when you eat it, versus when you're smoking it or putting it in. I have a gentleman now who's working on, do you know the Listerine strips that they make now?
Yeah, yeah.
Working on putting the marijuana in those type of strips.
Oh, what's his number? I mean,
so what you're gonna do now is you're gonna put it on the inside of your cheek, and that's gonna basically absorb into your bloodstream.
Oh, they're looking for people to work in this. They're looking for didn't anybody study this? Any volunteers?
Scroll just because.
Go ahead, Doc.
So what they're looking at is increasing the bioavailability of the THC into your bloodstream. But if you're eating it, then you're losing most of it just because your stomach acids are killing it.
Okay.
Now I want to ask a question. I'm sorry, D. Let me just ask this. I came across a woman on YouTube one time. I thought it was fascinating. She said one of the things that kills the male libido that people don't realize is mouthwash. So I just want to know, and she said that because some of the bacteria or enzymes or something, and she said people don't know that that is one of the quickest ways. She said mouthwash is bad for your libido.
I disagree. I think it's the if you got a loud mouth woman, that kills the libido.
Yes, dental health is very important. Dental health has been linked to a multitude of problems, including erectile dysfunction, heart disease, cancer. So we all need to take care of our dental procedures. You need to make sure that you're flossing and that you're brushing on a regular basis. The mouthwash that they talk about is because it may be masking the problems that you're having, a problem that they're having in their mouth. So we need to make sure we go to our dentist. That's our other, as they call it, primary care doctor. We need to make sure we go to our dentist and also go see your ophthalmologist or optometrist to make sure your vision is okay.
Okay. Yeah.
We got
so
go ahead, Rodney. Now let me go to the comments. Go ahead.
All right, thanks. So what would you recommend as things to keep your libido up as a man?
Gotcha. The best thing,
side woman.
Y'all hate to say it, exercise.
Side woman. Side woman. No. Oh, okay.
Exercising.
Yeah.
So, and if men don't want it, a lot of men don't want to hear, but exercise would do it. So there's a study out there that says if you lose 20 pounds, gain an inch on your penis.
Yes, I heard that.
Yes. So lose 20 pounds, gain.
Hey, give me those weights. Give me those weights.
So yeah. So increase your exercise, increases your testosterone also.
Yeah.
And makes you feel good about yourself, and as a result, yes, you will increase your sexual desire and your libido.
Okay.
Jamie, bring up some of the questions, brother. You got a lot of them, so let's get to them.
Yes, Miss Allie. Do you think bringing a vegetarian or a vegan is healthy for people? Being a vegetarian or vegan is healthy for people?
Yes, I think eating more fruits and vegetables is always good. So if you're eating more vegetables, you need to make sure that you find a way to get protein in your body as well. Whether that's nuts, whether that's a multivitamin, whatever you need to do, you still need to get protein in your body. So being a vegan, being a vegetarian does have its advantages. Some people say they feel better, have more energy. So it's one of those things where I think that's what works for you. I don't know if that's a lifetime lifestyle choice. I think eating is one of the pleasures of life. And, you only have a certain amount of years on this earth. So you do need to enjoy the pleasures of life. And eating is one of those pleasures. You just can't go overboard. You just can't, you have to do everything in moderation.
Jamie, you got another question you going to bring up?
Yeah. Does reduction in sugar intake help decrease inflammation in the body?
Yes, that is one thing that they're looking at is the amount of sugar that we eat way too much sugar. In fact, I consider myself to be addicted to sugar. I feel like I need to have a cookie or piece of cake every night or a piece of candy or something. But yes, sugar does cause inflammation. It gives you what we call empty calories. Your brain is telling you, hey, I'm hungry, I want something, and you give it sugar. It only temporarily alleviates that problem that your brain is telling you. So sugar does give you some empty calories, and sugar does cause some inflammation throughout your body. So yes, decreasing it will always help. That decreases the calories and makes you feel better, and also decreases weight.
Really quickly, is sea salt a big difference maker versus regular processed salt?
That is one they're looking at also. Sea salt has less impurities, I guess, in it. And one of the things they're looking at is, does that cause people to have an increase in high blood pressure or increase in things that are developing from salt? So I would say sea salt may be better than iodized salt, but still you need to be careful about how much sea salt you're putting in your body and sea salt you're putting in your food.
Gotcha.
Quick, I got another question for you. Depression screening. How important is that? Like to get
Sure.
mental health?
Well, I think during this time period, we're seeing a lot more depression, especially because of COVID. people at home by themselves, not able to go to work, not seeing family and friends. So when you go to your doctor, please ask them to do the depression screening. It's a simple 9-10 question test, written questionnaire that you do. You complete that test and you turn that in to your doctor, and he's able to score it, and he's able to tell you if you are no depression, mild depression, or severe depression. So it's very important. That should be done on a yearly basis.
Okay. Also, doctor, right now we are pretty sleep deprived nation. I know this is something that I struggle with right now. You know, what are the effects of that on our health, and how can we get, what can we do to get more sleep?
Sure. First, we talk about sleep hygiene. So one of the things I recommend, especially to parents who have kids that are teenagers, young teens who are in school, take their phones out of their rooms. I tell my parents, my parents, none of my kids, they're not on call at the emergency room. They're not brain surgeons. They don't need to have their phone in the middle of the night. So take their phone, put it in your room, let it charge in your room, and let them get it the next morning. Don't let them tell you that they need it for the music or for the alarm clock. Get them an alarm clock. So one of the things that we all need to do is take our phones out of our rooms, because the first thing we do when we wake up is we reach for our phone to see what's going on. What email has come, who's texted you, whatever's going on, what social media you're looking at. And what that does is that takes us away from our sleep. That decreases our sleep. All the bells and whistles and notifications that are going off, those things, they break up our sleep. So we need to make sure we get that out of it. We need a dark room. So those who work at night and having to sleep in the daytime, you need to make sure your room is dark as possible and as less noise as possible. You know, some people go to sleep with the TVs on. We need to get rid of that, because that TV and that lights blinking on and off, that's gonna interrupt your sleep as well. So we need to do that. You need to get on a regular schedule. So if you go to bed at 10 o'clock, 11 o'clock at night, you need to do that on a regular basis and get up at a regular basis. Even on the weekends, you get up at the same time. If you notice that you on a regular schedule, your body will get used to it and start waking you up on your own. You feel a lot better. So I think those are the things we got to start with. Also, stay away from caffeine. Drinking caffeine late at night, your sodas, drinking those late at night, that will affect your body. People having to get up in the middle of the night to have to urinate all the time, that affects it. So watch what you're drinking before you go to bed, because that would definitely affect your sleep.
How about melatonin and stuff like that? Natural stuff.
Melatonin is a natural product that is sold heavily, that does aid in people going to sleep. Now, there are products out there. All the products out there, they help you fall asleep, but none of them help you stay asleep. So make sure you find ways that that has your bedroom situation set up so that you can stay asleep. You need a cool, dark room with minimal distraction. That's what you're looking for.
You need a good weed connect, good weed man. But anyhow, I got the best sleep back in the day, long time ago.
I agree with you with the cool thing. I don't know how people sleep when it's hot. I don't either.
It gotta be cool. Gotta be cool.
Yeah. I don't know how they do it.
Now, I'm not saying cold, because I have some friends who their wives have the hot flashes, and so they're sleeping with a stocking cap on at night because it's so cold. Because she has the air conditioner on and the fan going, all that in the wintertime. So I don't know about that, but it needs to be cool, not cold.
Right.
Yeah. Sound like she's trying to collect on insurance policy. That's what that sounds like to me.
Why are there 4 men on the panels and no females?
It's a man show.
Oh, got it.
Yeah.
We got to Jamie, can you bring up a couple more viewer questions, please, bro?
Okay.
Jamie, is he there? Oh, there we go.
Oh, here's a good one. Is room temperature water better than cold water?
That's a good question. I get a lot of that question now. And the answer is probably yes. That no one's done an official study to say, one is better than the other. But I think drinking it at room temperature much better than your body. It doesn't shock your body as it's going down. So yeah, I would say drinking room temperature is better than cold water.
I hear a lot about cold tubs or cool tubs for recovery. And now they have these places, I think, in certain places where you can go in to almost like a freezer type environment. Is I forgot what it's called, but something about
biotherapy.
Yes. Why is it so important to cool the body down below a certain temperature?
What they're trying to do is when your body is cooled down, it all of the body functions also cease or slow down, not cease, but they slow down. And so what they're trying to do is they're trying to slow your body down so that it gives it time to recover from muscle injuries. And so that's why they used to have the cold tub in the training room when you were playing football or sports, or putting ice on your knees. And that's basically to decrease the inflammation that's going on in that particular joint.
Doc, I got one last question from me. Right, I was looking at your resume. First of all, it's extremely impressive.
Very impressive. Thanks, appreciate it.
And the thing is, I want to ask you this: I see you're certified as a ringside physician for boxing and MMA. Yes. So that means you get to go to the fights for free, right?
Yes.
The thing is, I always wanted to know this. I always know there was a ringside physician at every fight. Your job is also to check the fighters before the fight, or you're just there in case the fighters get hurt during the fight?
Good question. So what I do is we have there at the weigh-in, which is before the fight, usually a day or two before the fight. Those fighters also get a physical done. Okay. So I'm there to do their physical at that point as well. So I'm checking their heart, lungs, to make sure they don't have any broken ribs or broken fingers, anything like that before they get in the ring.
Gotcha.
While I'm there at the ringside, I'm there to make sure that they're safe. I'm there to stop the fight if I feel like if the fighter or the boxer is compromised in any way, the blood is running down their face, they can't see, that I may have to stop the fight. Mm-hmm. And then I'm also there if there's something where there's a knockout or some kind of major injury to facilitate getting that person to the hospital via the ambulance. Because at every fight, not only is there a doctor, but there's also a paramedics crew as well.
Mm-hmm. All right. That's amazing. I think that's an awesome job, Doc.
I appreciate it. Yeah, I'm here in the state of Georgia. I'm certified to be boxing and ringside boxing and mixed martial arts here in the state of Georgia.
Beautiful.
Okay.
And I've been doing it for probably 20 so years.
Beautiful.
Great.
Doc, anything else you want to let us know before we wrap up with you, man?
Sure. Just, I think we are getting more conscious about our health. We need to stay on top of our health. We need to make sure that we are in control of our own health. If we are able to exercise and eat better, we'll realize that a lot of our problems will go away or decrease our chance of getting. As we're getting older, we are having more family, more friends who are passing away at our age. And so, health becomes more and more important. So men, stay on top of your health. Women, thank you for helping us men stay on top of our health. Women, make sure you will get on yours, because women are the drivers of the healthcare process. They usually make the appointment. They usually tell the man when he's going and what time he needs to be there. And then I make sure the wives come, and so they tell on the patient, tell on their husband what he's doing and what he's not doing. So stay on top of your health. And I think that is the key to this, is going to your doctor on a regular basis. We have jobs, we have health insurance, then might as well use it. So that's what I have to say. And if there's any questions, you guys know how to get in touch with me. I have no problems in answering questions via text message or email.
Yeah.
Can I ask one last thing, D, before you wrap? Just one last thing.
I just saw 2 more questions people ask. So go ahead.
Okay, I was going to ask one. I want to ask one last question. Are you familiar with Dr. Sebi? I believe, is it Sebi or Sebi, guys?
Sebi.
So I started reading some of his stuff, and I know he had some maybe unconventional ways of dealing with nutrition and things. And one of the things that he's completely against is any type of food that comes out of the ocean. However, I happen to have a different viewpoint as far as lobster and shrimp is concerned. And I just want to know.
You talking about lobster is in that slave food that we used to get?
Oh,
lobster used to be slave food.
Lobster?
They threw it away. They didn't want it.
I used to heard it was fertilizer for the Indians also.
Yeah, they didn't want it.
They used to give the prisoners.
Sea roach, man.
Right. It's a scavenger. So with his
scavenger food.
His point was, he said you should not have fish rotting in your intestines. And it hurts when he said it. But what I'm saying is, what is our perspective? I heard the ocean is so toxic or so bad. What is the perspective right now on seafood? especially shellfish in particular?
Well, seafood. I mean, seafood itself is better than some of the other foods. So that's fish, which is a very lean meat to eat. So seafood is good for you. Shellfish like lobster, shrimp, those foods, they do eat or scavenge the bottom for waste, and they are eating everything. So I've known people to get allergies from them. Not necessarily because of the actual shrimp or the lobster, but because that shrimp or lobster was in a water at that time that they ate something that caused them to be contaminated. So I think you need to be careful about where you're eating it, eating good food. But I wouldn't say take away shrimp or lobster out of your diet. Those are very lean meats. And I would say, eating things in moderation is always good.
Okay.
Okay. See, I see food, I eat it. So, so Jamie, can you bring up a couple more questions? I think Monique and Loretta had some questions.
She said, I drank 100 bags of black tea within 2 weeks. Is that bad?
I think that's a little bit more than moderation.
Yeah.
Why are you drinking so many bags of black tea? So that would be my question.
She pro-black.
She's pro-black. I was just about to say that. That's overboard on pro-black.
Here's another one. Any natural remedies for winter depression?
Yeah. Winter depression is also called seasonal affective disorder or seasonal depression. There are some lights that you can get put in your own house so that you can get some that vitamin D. So I would definitely look at that. Exercising, going outside, even if you're just walking, get yourself that vitamin that you need for your body. So I think those will help.
Yeah.
So Doc, we about to wrap up with you, man. So where can people find you at, man?
Sure. I don't do. I'm not big into social media as of yet, but I should get into it. But I have an email address. I'll put my email address in this chat here.
This was very good, and
all right, Jamie, put that on the screen.
Answered a lot.
Yeah. So this is great, man. Ronnie, you got anything?
I put in there. So that's Mr. CCJR1234 at Gmail, and that's because I'm Curtis Cheeks Jr. So I make it easy.
All right,
Doc, we really appreciate you coming on the show, and we're going to send something in the mail for you. We're going to send you a shirt and a mug from Let's Chop It Up.
Appreciate it.